Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hi, everyone. This is Annie Rogers, and on behalf of the Attitude team, I'm pleased to welcome you to today's ADHD Experts presentation titled The Right Questions to Ask Before, During, and After an ADHD Diagnosis. Getting an ADHD evaluation for your child can be time-intensive, expensive, and confusing. The diagnosis and treatment of ADHD often requires many professionals, several components, and it's important for parents to understand what to expect during the process and what options are available. Also, knowing the right questions to ask can make a huge difference. In today's webinar, parents will learn what questions to ask, why, and to whom. We'll discuss key information to seek out during the first appointment, feedback session, and routine follow-up meetings. Leading today's presentation is Dr. Norrine Russell. Dr. Russell is the owner of Russell Coaching for Students, which she founded in 2009. Russell Coaching provides academic and ADHD coaching to students across the United States, Canada, and the UK. With more than 20 years of experience creating positive youth development and parenting education programs, Dr. Russell has extensive knowledge of child development, learning styles, special needs, and positive parenting philosophies. She blends this knowledge to provide students and parents with comprehensive support and the tools they need to grow and thrive. Dr. Russell has a Ph.D. from Bowling Green State University with a focus on psychology and education. She is also the author of Asking the Right Questions about ADHD before, during, and after your child's diagnosis. Before I hand over the microphone to Dr. Russell, I have just a few housekeeping items. If you are tuned into the live webinar, you can submit your questions at any time by navigating to the text box under the video player. To download the slides, click on the Event Resources section of your webinar screen. And if you are interested in the certificate of attendance option, just look for the instructions in an email about an hour after we wrap up the live broadcast. If you are listening in replay or podcast mode, visit attitudemag.com and search podcast 421 to access the slides, the webinar replay, and the certificate of attendance option. If you support the work we're doing here at Attitude, we encourage you to visit attitudemag.com/subscribe and sign up for Attitude Magazine. Finally, the sponsor of today's webinar is Play Attention, Improve Executive Function and Self-Regulation. For more than 25 years, Play Attention has been helping children and adults thrive and succeed. Tufts University School of Medicine found Play Attention significantly improved attention, executive function, academic performance, and behavioral control of ADHD students. Your program will include a lifetime membership and a personal executive function coach to customize your plan along the way. Home and professional programs are available. Call 828-676-2240 or click the link on your screen to schedule a free one-on-one consultation. You can also visit playattention.com to learn more. Attitude thanks our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. So without any further ado, I'm so pleased to welcome Dr. Norrine Russell. Thank you so much for joining us today and leading us through these critical questions to ask during the process of evaluation and diagnosis for ADHD.
Well, thank you for having me. I'm thrilled to be here because I think this is something that I see parents struggling with on a daily basis at my practice. And it is really hard to get the practical, concrete, hands-on information that you need to navigate getting a diagnosis. And so I really want to thank you for having me here today to do the presentation. And I hope that what parents take away is an understanding of how they can be a better, stronger, more engaged advocate, and why they need to be such a strong advocate for their child with ADHD. So thank you for having me. Let's start with the question of why is ADHD diagnosis and treatment so hard on parents? When you meet parents who are considering, should I have an evaluation done for my child? Does my child have ADHD? They are usually wringing their hands. They are sometimes crying. They are stressed out. It is a different medical process than so many other diagnostic procedures. And this catches my attention all the time at my practice, where we see dozens of students a week, and we hear so many stories about how hard it is to navigate the diagnostic process and the treatment process. And so that's really what today's presentation is about, is how do we make this process easier? And what I've done today is try to provide you with, again, concrete, specific tools that you can use. So I feel like this slide is really how people feel when they start to consider the question of, does my child have ADHD? There's all these questions, but it's not clear what the questions are. There's just all kinds of questions and confusion, and they don't know what the answers are, but they don't know what questions to ask or who to ask them of either. And that part is hard. I want to give a few examples of other medical situations as we begin today, because I think this will make it clear for the audience why parents take on and have to take on and are asked to take on so much in getting an ADHD diagnosis, because it's a different diagnostic process than so many other medical situations. So let's take, for example, a broken arm. Okay, that's a common one. Many parents have dealt with their child having a broken bone of some kind, a broken arm, a broken wrist. I have a client right now who just broke his wrist falling on his college campus. And this is sort of the typical series of events of what we might expect for a broken arm. I mean, obviously it can happen lots of different ways, but kid breaks his arm, maybe it's on the playground. School calls 911. 911 does triage, takes him to the hospital. The hospital does an initial assessment, sends him for x-rays. The radiologist takes the x-rays. An orthopedist reads the x-rays. The orthopedist tells parents, yep, you have a broken bone here. We're going to put a cast on it. They might put a soft cast on for the initial few days while the swelling goes down, and then put a hard cast on. But they basically say, this is what's going to be needed. The cast gets put on. The parents are told when to make follow-up appointments. At some point, the doctor decides that the cast is ready to come off, and a script is sometimes given for physical therapy. Now, what I love about this example is that it shows you quite clearly what is the role of the medical professional and what is the role of the parent. And what you see is that the parent is supporting and comforting the child, but the parent is not becoming any kind of medical expert in orthopedics. Okay? So think about that. That's my point. At no point is the parent asked to assess, is the bone open? Is an x-ray needed? Should we put on a cast? How long should the cast be on? How much physical therapy should be needed? The parent is not really the medical expert. Parent is not really even on the medical team. The parent is on the team as a parent to support their child, but they are not being asked to have medical knowledge. Let's take a look at a second example. Does my kid need glasses? So there are children who fail their eye exam at school or in the pediatrician's office. They get referred to an eye doctor for a complete eye exam. The eye doctor does a complete eye exam and determines whether or not there is a need for corrective lenses. At no point, if you've been through this process, you know this, are you asked, well, do you think the child's eyesight is 20/20? At no point are you asked that. if there is a need for corrective lenses, the doctor figures out exactly what the script is, what lenses are needed. The doctor gives the choice, depending on how age appropriate it is, for frames or for contact lenses. And those glasses or contact lenses get picked up and the child begins to wear them. And interestingly and relevant for ADHD, the doctor will give you advice on when does the child need to wear glasses. So I have 2 children myself. They both have glasses, and I have very clear directions from their ophthalmologist about when they need to wear their glasses and when they don't need to wear their glasses, which was helpful information to receive. So there's our eye doctor, right? Doing the diagnostic work to figure out what prescription does this child need for glasses at her age. The parent might be asked, is the teacher saying the child has trouble seeing in class? But that's about all. The parent is simply there as the parent to support their child and maybe to pick out the fun frames. At no point, again, just to underline this, is the parent asked, oh, do you know what your child's eyesight is? Do you know how strong a lens your child might need? Do you know if the lens is working for the child? No, the eye doctor does all of that. The parent is not the medical expert. Parent doesn't even have to be a medical advocate in these situations. The medical experts take over. They are the advocates. They run the process and they make the process work. And the parent gets to be the parent. Now, when it comes to ADHD, we have a completely different situation. Why? Why is this? Why is this so complicated with ADHD? First of all, there are so many questions that we have in our culture about ADHD. Well, what is ADHD anyway? Everybody knows what it means to have a broken bone or to need glasses, but most people in our culture don't actually know what are the 3 core symptoms of ADHD. Most people don't know, even parents who think my kid might have ADHD, most of those people don't know who diagnoses ADHD. Most don't understand why so many different professions can diagnose ADHD. Most also wonder, is it really just a school issue? Should I wait it out? Is it just this teacher? Is it just this class? Is it just this school? And then, of course, we have what I think is sort of the most popular question or comment that people hear all the time. Well, doesn't everybody have a little bit of ADHD anyway? And so does it matter? Your kid probably doesn't have ADHD because everyone has a little bit of ADHD. And so the way that we discuss and think about ADHD in the popular press, in the education system, in parenting guides, is, I think, confusing and leads us back to this point where when you're a parent and you're trying to think, okay, does my child have ADHD? How do I find this out? Am I supposed to find this out? Should someone else be telling me? All that we have are those vague questions in the back of our head. Those questions are why we wrote the book, Asking the Right Questions Before, During, and After Your Child's Diagnosis, because we wanted to give people a very clear set of guidelines about what questions would be most helpful to ask if you're in this situation of thinking, my child might have ADHD. So the book is a small book, it's a short book, and it really is written for one purpose and one purpose only, to help parents become empowered to become the kind of advocate that they need to be for a child with ADHD. And again, I just want to underline this point. I think that parents of kids with ADHD need to become stronger advocates than parents with many other medical health conditions. And so this book is about empowerment and it's about education. I'm going to skip this couple slides that are next. I put them in here because I know that when Attitude distributes the slides, there are a lot of people who are unable to join live. And so I wanted to put in a description of the book, but I'm just going to let you peruse that on your own. You don't need to read the entire summary of the book, but I wanted to include it for those people who are unable to join live. But this is the information about the book. And then the URL for where to purchase the book, which is available in print and on Kindle. For those of us who are here today, though, right now, what we're going to do is we're going to launch right into what are these questions? How do we know? How do we become informed about what questions we ask? And just as importantly, who do we ask them to? And so what I have put in this presentation is basically the entire contents of the book in terms of the questions we recommend that parents and caretakers ask about ADHD. So that's the purpose of today. We're not talking about how to understand ADHD. We're not talking about how to diagnose it. We're really talking about what to ask, why to ask that question, and who to ask the question. We're not going to have all the answers to the questions we suggest you ask. That's impossible to do in 60 minutes. And we also think it's so important that you take these questions to your treatment team. If you don't have a treatment team yet, as you begin to put one together, there are specific professionals that you'll want to ask specific questions of. So today's webinar is going to give you tools, which are questions to ask your providers, your medical providers, your mental health providers, and your school providers, and anyone else who's on your child's team. All right. Everyone ready to get started? Let's do this. Let's get started. Okay, so we have 5 suggested questions to talk about before the diagnosis. And this might be a set of questions that you ask the pediatrician. It might be a set of questions that you ask a psychologist that you're calling to see if they are able to do an evaluation. It might be really anyone that someone has suggested can do an ADHD evaluation. But the questions are, what is ADHD and what are the 3 core symptoms of ADHD? We should know, right? As parents, how does ADHD get diagnosed? We should know what are the 3 core symptoms of ADHD. In my practice, I'll ask parents frequently, how well controlled is each symptom for your child? And they'll say, I don't really know what the 3 symptoms of ADHD are. And so I think that's the important starting point is we have to know what qualifies your child for an ADHD diagnosis. And so you can ask that question of any professional who's qualified to do an evaluation of ADHD. When should I get my child evaluated for ADHD? In the book, we cite the American Academy of Pediatrics 2019 Best Practices paper frequently. And their answer to this question is, if there is any concern whatsoever about an inability to regulate attention or impulsivity or learning differences or difficulties, you should get the evaluation. And so the American Academy of Pediatrics comes down very hard on the side of, yes, if you are concerned, you should get the evaluation. Don't wait. Don't think about maybe it's just 3rd grade, maybe it's just 6th grade, maybe it's just that he's a boy. Get the evaluation. And what we do have in the book is a reference for additional information for each of these questions. But this is a question that I would ask whoever you're calling about evaluation. When should I get my child evaluated? But the answer is pretty clear. If there are concerns, you should get the child evaluated. The same way we do if we're worried, do they have COVID? We do the COVID test. Do they need glasses? We go to the eye doctor, right? My daughter right now has some mild curvature of her spine. We see the spine doctor every 6 months to monitor how much has her spine changed. We don't put off medical care if, again, all things being equal, the medical care is accessible and available. All right, third question. Who should I take my child to for an evaluation? This is, I think, one of the most complicated and difficult parts of ADHD because there are several different medical fields that can diagnose ADHD. A licensed psychologist can diagnose ADHD, but a licensed psychologist is not an MD, and so they cannot prescribe medication. Within the field of medicine, a pediatrician can diagnose ADHD, and they're the most frequent ones to do so. Or you can see a neurologist, or you can see a psychiatrist, or you can see a developmental pediatrician. And so think about, as a parent, you're trying to figure out, who do I go see? And you're asking, the neighbors, or you're asking, the chat group for your neighborhood on Facebook, or you're asking at the PTA, and everyone's got a different response. Well, we went to a neurologist, we went to a psychiatrist, we went to a nurse practitioner. That's confusing. It doesn't help the parent understand who they should go to and who's qualified to do this. And I think that's one of the primary confusions of this stage of, okay, I don't have a diagnosis yet. I'm trying to figure out if I need an evaluation, who do I go to? Why can so many different people diagnose this? That's not the case with something like cancer or diabetes. There are one specific medical professional that does that. But with ADHD, there are several different medical and mental health professionals who can diagnose ADHD. And it's important just to realize that so that you're less overwhelmed and less confused by the fact that your neighbor went to a neurologist and your neighbor on the other side of you went to a psychiatrist. Should I wait or should I get an evaluation? Again, the answer to this is so clear when you look at the research. You should get an evaluation done for your child. If the results are inconclusive or the results show that there is no ADHD, great. You've ruled that out as a possibility of what might be causing some of these symptoms or problems in school. But this was an important question to include because so many people think I should wait or I could wait. But what we're learning is that the sooner the better, and age 10 seems to be a pivotal time to have the diagnosis identified by. And then lastly, does a diagnosis mean my child will need medication, which is something that's uppermost in many, many parents' minds. And it's something that each parent has to go through their own journey and process of becoming educated about. The American Academy of Pediatrics, as well as the American Psychiatric Association for Child and Adolescent Psychiatry, are all in agreement that medication is first-line treatment for ADHD. But this is a hard, difficult one for parents to come to terms with often. And so it's important for you as a parent to ask that up front. And you're going to get a lot of different answers. And I think it's important to be aware that you're going to get different answers. A licensed psychologist may stay well within their lane and say, I don't know, that's going to be a question for the medical professional. The medical professional may punt the question and say, well, let's get the evaluation done and see, how severe the symptoms are before we make that decision. But one thing that we were very clear about in the book is that the science is in 100% agreement that medication is first-line treatment for ADHD. And so at some point, if you receive an ADHD diagnosis for your child, you will in all likelihood be having a conversation about medication. And even just that much alone sometimes can be overwhelming for parents. All right, let's talk about what questions to ask during the diagnosis or the evaluation. And again, here we're imagining that you could be at the neurologist, you could be at the psychiatrist, you could be at a advanced registered nurse practitioner, you could be at the pediatrician's office. First question you're going to ask is, how will you diagnose ADHD? Because this speaks to our fundamental confusion about, doesn't everyone have a little ADHD? And doesn't everyone have some of this? Well, yeah, everyone has trouble paying attention sometimes, for sure. But does everyone meet the qualifications for ADHD? No, absolutely not. 5 to 10% of children are the estimates. So you're going to want to get a sense of, what is the professional going to do to diagnose ADHD? And then one of the things that parents may want to ask as a follow-up is, okay, so there are questionnaires for this. How reliable are those? How valid are those? It doesn't feel as satisfying to have a questionnaire as it does to have some kind of blood test or genetic test. But it's important to understand how reliable and valid those questionnaires are in doing the diagnostic process. A second question is, how likely is it that my child will be identified as having ADHD if they really don't have it? So this is a primary concern for a lot of parents. I don't want to take my kid in and, they tell everyone they have ADHD. Ask the question. Does my child have simple or complex ADHD? How will I know? So here we're talking about, do you have a child who's one of the approximately 30% who only has ADHD? Or is your child, and this is obviously much more likely, part of the 60 to 70% who has ADHD and a comorbid condition, perhaps autism, perhaps anxiety, perhaps dyslexia. But this question is important to ask, because if you only get your child tested for ADHD, which is not what the American Academy of Pediatrics recommends, and you don't get a complete evaluation, there may be something else also going on that's contributing to learning problems or difficulties at home, and we don't have the whole picture. And so asking this question shows the doctor or the professional that you're aware that the statistics are, it's likely my child has something else also going on. What are those things, and how are you going to look for them? And that relates to question 4. What are the other conditions that are likely to coexist with ADHD that I should be aware of? And that's easy to Google and find, but they are the mood disorders, learning disorders, autism, tic disorders, seizure disorders. And so you're just going to want to ask the doctor, how do you look for and rule out those other disorders? Okay, continuing with this stage, because this is a long one, during the diagnosis and evaluation, what is ADD and how does it relate to ADHD? We've done some really complicated work here with the title of this disorder over the last, 30 to 40 years. So we used to have ADD and ADHD. Now we call everything ADHD, and sometimes it has hyperactivity and sometimes it doesn't. But if you're curious to know technically how is it defined, ask the doctor, what does that mean? And if your child is diagnosed with ADD or ADHD, primarily inattentive, ask, what does that mean? What does that look like? How is that different from a child who also has the hyperactivity component? Another question to ask, and this is a question for both school and your medical professional, what is the difference between a school evaluation and an outside evaluation? This is very important to understand, and it has enormous consequences for what services and benefits your child is going to qualify for. And so you want to know if a school evaluation is going to serve your needs, or if you might also want to consider an outside evaluation by an independent medical professional. If you're talking with the school psychologist or the school team, what process can I expect in a school evaluation? And really ask them to take the time to walk through, what is this data they're going to collect? Because that's going to be the first thing they're going to say. Well, we're going to collect some data. Okay, what is the data? I want to understand what the data is that you're taking a look at. And again, you want to ask this because you want to know when you get to the end of the line that your child has a valid diagnosis of ADHD. Question 8, same thing. What process can I expect in a private evaluation? Interestingly, you're going to get different processes from different medical specializations. So a neurologist is going to have a different process from a psychiatrist, from a licensed psychologist. So just understanding the process and how things are ruled out is important. Okay, more questions for during the diagnosis or evaluation. What is an IEP and does my child need one? And I did here, I cheated and I put in a little bit of a quick answer, although I think most of Attitude's audience knows the difference here. An IEP provides services. Question 10, what is a 504 plan? A 504 plan provides accommodations. Now, interestingly, what you're going to find is across the states and depending on the school district, kids with simple ADHD in one state might qualify for an IEP and actually get provided services. And in other states, they might only be found eligible for a 504. And so, again, going back to our purpose of becoming a good advocate, you may want to further ask, what services can school provide that would be helpful for my child with ADHD? Why would we only consider a 504 if there are services that could help my child? And could we talk about an IEP? And you'll get a different answer in every single school district, I can promise you that, but it's a question worth asking. I see many students who are served beautifully with an IEP with services for ADHD that involve going far beyond having extra time, which is what happens in many states where education is not as well funded and the child ends up with a 504 where they have extra time and maybe a small group testing. Is ADHD considered a learning disability? This is something that interests people because they just simply want to know, does this fall under the category of a learning disability? It doesn't really, it qualifies as a psychiatric disorder, but it does affect learning. And so the answer to this one is a little bit unclear. You can think of it as a learning disability because it causes difficulties with learning. But I think it's important to get a sense from your professional of what do they think? Is this considered a learning disability? All right, question 12. What is executive functioning and what does it have to do with ADHD? So most of you as parents by now, if you're tuning in today or you're listening on the repeat, have heard of executive functioning skills and this idea of these are the skills that you need to function in life. These are the skills that allow your brain to organize itself. They are the executive skills of the brain. And to be honest, the easy answer here is that every child who has ADHD is going to have problems with executive functioning skills. They may very well have some executive functioning skills that are strong, but it's going to be clear where they have weaknesses as well. And there are other beautiful webinars from Attitude that address executive functioning skills and how to assess them and how to strengthen them and things like that. But you can safely assume that if your child has ADHD, they have difficulties with executive functioning. And you can ask your provider, what information do you have about executive functioning, or where do you refer parents to learn about how they can support their child's executive functioning skills? Because this is really the skill building piece of the treatment that is needed in multimodal therapy. If my child is prescribed medication, what can I expect? I'm just a huge advocate of knowledge is power, right? So nobody wants to put their child on medication, in the sense of nobody wants to have a child who has any kind of need for medication. But I think that the more you become knowledgeable as a parent about what you can expect from medication, the better you're going to feel about the decision you make about using medication in the treatment plan. And so again, this is just another question to ask of the doctor or the nurse or the licensed psychologist who may refer you to a medical professional. But what can we expect with medication? One of the things that we frequently see in our practice is we see kids who are taking medication, but whose symptoms are not well controlled on medication. And there's a recent book published by Dr. Walt Karniski, who talks very clearly about the science of ADHD medications, and says that really should be possible for ADHD medication to mitigate 60 to 90% of the symptoms. And so when we talk about that statistic and we talk about that research with parents, parents will be like, oh, I don't know if we're there. He's better on his meds, but it's not great. I just did an intake this morning with a family who, 7th grade boy, and he is on a medication that works until about 3:00 in the afternoon. And they, of course, parents were telling me with all kinds of grief and frustration and sadness, how difficult it is to get him to do his homework. And I suggested that they contact their doctor, because what was really being asked of that child was to do their homework without any control, any symptom control for the ADHD. And so I think this weaves into this question of, if my child is prescribed medication, what can I expect? When would we be using medication? For how long would we be using medication? What should we see in terms of improvement, right? And that is really the golden standard for using medication. Is it better? Is it worse? Is this the same? And then figuring out how to, as the American Academy of Pediatrics says, titrate optimally with minimal side effects. Okay, let's move on here to questions to ask after the diagnosis or evaluation. So the first one is about, if your child doesn't have ADHD, if the report comes back and there's really not sufficient evidence for ADHD, what do I do now? And the way that we address this and what we recommend is make sure you've had a comprehensive evaluation, so that if there's something else that's causing learning disabilities, perhaps it's dyslexia, perhaps it's autism, perhaps it's anxiety, you've figured out what it is, not just that it's not ADHD. If there are no clues or signs, you may want to seek a second opinion, or you may want to wait 6 months and do a reevaluation. But there are still steps that can be taken when there is no clear indication of ADHD, but there are still either learning difficulties or symptoms that look like ADHD at home or at school. Okay, question 2. If my child does have ADHD, what do I do now? And this is where I think really I would love to see our field, our collective field of ADHD professionals, just become a little more united in how we address this, because there are best practices from the American Academy of Pediatrics about what a child needs. But I myself am the recipient of psychological reports that give me, 2, 3, 4, 5, 6 pages of, well, here's all the things you can do at home or at school. And then it's great to have this comprehensive list. It really is. I feel wonderful knowing there are so many things to do, but how do I prioritize what to do? And so that's a question to ask whoever has done the evaluation. What do I do now? You've given me pages and pages of recommendations. If you're a psychologist, what are the top ones I should follow? If you're a psychiatrist, probably you're going to have the conversation about medicine first, and then you're also going to have a conversation about a 504 or an IEP at school. But what you should know is that the American Academy of Pediatrics is very clear that multimodal treatment is what most students will do best on, and that is medication, parent education and training, and a school plan, and then in the later years, skill training and strategy training, like the executive functioning stuff. What role will the diagnosing professional play in treatment? A lot of us expect, oh, I'm going to take the child to this professional, they're going to diagnose them, and then they're going to treat them. And it doesn't work that way with ADHD often. Sometimes it does if you are at a medical specialist and they do the diagnosis, then they may well provide you with a prescription for medication, but they may not do the parent support piece of things. And so really have to get clear in our recommendations to parents that you need a treatment team for ADHD. And what does that team look like, and who should be on it? Who should be on it from school? Who should be on it from a medical point of view? Who should be on it from a mental health point of view? And just asking what the treatment team should look like to whoever diagnoses will help you have a productive conversation about what are the types of professionals who can help your child. I hope you can see that I would always be asking, what is evidence-based scientific treatment for ADHD? I was reminded as I was reading this recent book just published by Dr. Karnisky about ADHD medications, how many things are out there that are not evidence-based scientific treatment for ADHD, but they feel more palatable to parents. They feel maybe a little easier. They feel a little less risky than medication. But it is so very important to follow the science of what do we know about ADHD and what works. And so this question, I think, should be in bold, font size 72 in the book, although it's not. But really, because there are so many things that people have tried to address the symptoms of ADHD, a parent needs to know what is evidence-based scientific treatment for ADHD. The same way you would follow science for a broken bone or for cancer, or if your child needed glasses, we'd want to have a scientifically based treatment plan for ADHD. And that's a hard question to ask because, again, it brings up the concern about medication. And most parents have a little bit of a journey that they go on to learn about medication and to become comfortable with medication and to understand what medication should be able to do for their child. Okay, continuing these after the diagnosis or evaluation. Who can prescribe and manage medications? Your pediatrician can, because your pediatrician is a licensed medical professional, and your pediatrician may or may not be willing to do that. And they may or may not be willing to do it depending on how complex the child is. So if it's simple and it's one medication, the pediatrician may be willing to do that. Otherwise, they may send you to a neurologist or a psychiatrist or a developmental pediatrician to prescribe and manage medications. But you will need a medical professional, not a licensed psychologist. Why are there so many ADHD medications, and which one is best for my child? There are so many ADHD medications because ADHD medications make money. And because we are giving these medications to children, and it helps to have lots of different formulations. So a tablet, for example, that dissolves on the tongue, a liquid formulation that a child can take a spoonful of, a capsule that can be emptied onto yogurt or applesauce. And so that's one of the reasons there are so many different ADHD formulations of medications. For the stimulants, there are really only 2 active ingredients. And determining which one is best for your child, ask this question of the medical professional. Ask, how do they do this? How do they determine which one is best? And I think this is a question that should get asked on an annual basis. At this point, do you think my child is on the best medication for them? Because things change as we go from elementary school to middle school to high school. Are there over-the-counter ADHD medications my child can take? No, ADHD medications are prescription only. Ask the medical professional, what are the short-term and long-term side effects associated with ADHD medication? I specifically always advocate that parents ask about the appetite and appetite suppressant, because many parents find that to be a very off-putting part of medication. And so take the time and ask your doctor to take the time to explain the science of why there is appetite suppression and what effect that has on growth, short-term and long-term, so that you can make an educated decision about what thing is most important. And actually, what most of the research shows us is that while there is an appetite suppressant effect, there is not a permanent growth inhibition for medication. But these are questions to ask your doctor and to say, I have several questions to ask today, and I'd like to make sure I have enough of your time that I can ask them. Be an advocate for yourself to become informed. When will my child be able to stop taking ADHD medication? This is a question that parents often have, and you're going to want to get the answer from the medical professional who's prescribing this medication. The quick answer that we provide in the book is that, kids don't really outgrow ADHD. It changes in nature and form in adulthood, and some adults are able to manage it without medication. But what the American Academy of Pediatrics says is that ADHD is a chronic, long-term health condition to be managed. And so, again, going back to why are we asking these questions? We're asking so that we can become comfortable in our role as advocates. A few more of these, and then I know we're going to turn to Q&A. What is parent training and education, and who can conduct it? So this is something actually that's an easy Google search to look up ADHD, parent training and education, what works. There are a couple of programs that are designed specifically to help parents understand ADHD and work with their child at home in ways that will work. We know some things, right? Punishment doesn't really work for kids with ADHD. We need reinforcements to be immediate. We need reinforcements to be novel. We need to understand the neurology of it. And there are parent training and education programs that are approved to do this. And you can find that out through Google. But you can also ask the psychiatrist or the psychologist, what does my child need from their school? I would ask this first and foremost from the teacher. What does my child need to be able to learn? And then I would continue asking that question at the 504 or IEP meeting. 14, what is an ADHD coach, and does my child need one? How do I find the right coaching service? So an ADHD coach is simply someone who can help your child develop skills and strategies in addition to having the school-based support, the parent education, and having medication. Now, what I always say to parents who come to my office, and keep in mind that we are a very large coaching practice, is that coaching is as of yet unlicensed and unregulated. And so you're going to want to really make sure when you hire an ADHD coach or an executive functioning coach that they have experience, that they have a philosophy they work from, that they can show you what their model is in terms of changing and building skills and strategies. We've just done this internally at my practice, and our method is called connected coaching. But it is important for parents to understand that anybody really could call themselves an ADHD coach. Again, I have this question in this section because I think it's so important after the diagnosis. What is and is not evidence-based treatment for ADHD? Ask the question. Every time you have a new professional, ask the question. And then a few last ones. What causes ADHD? Your person who is treating the ADHD or who diagnoses it should be able to provide the answers to this. It's nothing you did. It's primarily genetic. How do I explain my child's diagnosis to my own child, first of all, and then to friends and family? I think this is a great area for getting professional advice, especially from a psychiatrist or a psychologist. What are the consequences of untreated ADHD? So this would be the other question that I would say, if I had a question that I could put in font size 72 in the book, I would make sure that everyone asks this. What about kids who don't get treated for ADHD, whose parents choose to just wait it out? What happens? It's important for us as parents of kids who have ADHD, and I have two who have ADHD, to know what happens if we don't treat the ADHD. And then this last slide is just a special section on school. And what we have is, what questions should I be asking for my grade schooler, my middle schooler, my high schooler? And then again, most importantly, because we know how challenging college is for young adults with ADHD, what questions should I be asking as my young adult with ADHD goes off to college to prevent that high failure rate? So just to recap, the purpose of today's webinar was not to answer all of these questions. I gave some brief answers here and there, but it was really to, I hope, encourage, motivate, empower you to normalize the process of asking lots and lots of questions to everyone on your child's treatment team. What to ask, why to ask, and who to ask. That's what the purpose of today's webinar was. I want you to leave with, an idea of, what? I've always wondered that, but I've never thought to ask the doctor that. Or, I didn't even realize that there might be an answer to that question. Or I've never even thought about that question, and I'm going to call our psychiatrist and see if I can get a 15-minute phone consultation to ask this question. Is this medication the right medication for my child right now? What should we expect from medication? What happens if we don't treat? That's really what I want, is for you to have this list of questions at your fingertips that empowers you to become more well-educated. Because what I believe, what I know to be true, is that the more we know as parents, the better advocates we are, then the better the outcomes are for our children. And that's what's important to me. And it's often us as the parents who are driving that treatment. So parent knowledge makes us effective advocates, which leads to better treatment for our children, which is really the bottom line of today's webinar, which I hope you've enjoyed. I know we've gone through a lot of textual information, but I really didn't want you to have to run out and buy the book. I wanted to provide you with the complete set of questions if you were tuning into the webinar. And so at this point, let me wrap up and turn things over for any Q&A that we might have today.
Thank you so much, Dr. Russell. That was a really comprehensive roadmap, and we do have some questions. I will very quickly thank our sponsor, Play Attention, one more time for allowing us to host this webinar today. One sort of essential beginning question that parents are asking themselves is, how young is too young? You said if you're wondering, should I wait? Don't wait. Is 4 too young? 6? Can you offer some guidance for when parents should begin this process, or how early they could begin the process?
Sure, absolutely. So what I'm going to tell you comes directly from the American Academy of Pediatrics white paper. And what they would say is if you see what looks like it could be ADHD at any time, age 4 and up, go ahead and speak to the pediatrician or seek out an evaluation. That 4 is not too young. I know my own son was actually diagnosed at 3, and the doctor was like, this is very young, but you have a very clear-cut case of ADHD. I think this might have been because my child barged into the office and climbed over the office counter and ran down the hall to the doctor's office. And so there was really no question after the doctor listening to us for 20 or 30 minutes and doing the questionnaires. But age 4 and up, it is not too early.
Right. And though we should note that most medications are approved for age 6 and up, but that does not preclude you from seeking a diagnosis.
Yes.
Yes. And here's a common problem we heard from one listener here today. A parent feels that there are signs their child has ADHD. However, he or she is doing well academically. And the teachers insist that an ADHD evaluation is not necessary. But then, as we know, you talked about executive functioning, things typically tend to fall apart around middle school. What can a parent do when they first encounter that pushback earlier,
right,
maybe in elementary school?
Yes. And I think that's sometimes where we see it. I remember telling my daughter's kindergarten teacher that she would be absent because she was going for her ADHD evaluation. And this teacher, who was so well qualified and a great teacher, and my daughter had a wonderful experience with her all year, she said to me, she can't have ADHD. She's so cute. I think we have the same kind of idea about, well, they can't have ADHD. They're so smart, or, whatever it is, they can focus. So, here's the thing, as an advocate for your child, if the place you're asking that question, should we get an evaluation, is school, and school is saying no, but you're seeing things that don't look and feel exactly typical, or that you think might even look like ADHD, go ahead and seek an outside evaluation. Start with your pediatrician. Now, what you may find is that a pediatrician or an outside person will say, yes, there's mild ADHD here. We don't need to do anything about it right now. But as the demands of school ramp up, whether that's in middle school, whether that's the beginning of high school, second half of high school, then there may be more of a need for treatment. But we can see some mild symptoms of ADHD. But for now, you could probably put a 504 in place and maybe some specialized skills and be okay. So my bottom line answer to the question would be, don't let any one person be determinative of whether or not your child should get an evaluation. Even if they're doing really well in school, they may be working extra hard in school, or they may be stressing themselves out in school, or they may be also cheating in school and doing well in school. I'm not saying that's the case for anyone's child, but, we don't have all the answers. And so the way to know if your child has ADHD is to test for ADHD. And so regardless of whether school says, yes, you should, or no, you shouldn't, if you are concerned, get the evaluation. How does that feel for an answer?
Yes, I like that. Excuse me, because there are some biases. I mean, even teachers with the best intentions may have a preconceived notion about what ADHD looks like, and your child may not fit that bill, especially, right, if they have inattentive symptoms as opposed to hyperactive or impulsive ones. So
Yeah.
You are the best judge of your child. Excuse me. I did want to make a point too that you reiterate. You said we've presented here today. You have presented the questions to guide you through this process. The Attitude website, we have more than 8,000 articles. There are easily 2,000 articles about all this content that we covered today. So it is there, and we will think about ways to, provide some of this guidance. There are parents who are confused about, rightfully so, IEPs versus 504s. There's a lot here. Don't feel too overwhelmed. Know that information is out there. Attitude is there for you. Dr. Russell's book is there for you. And there is a lot, but we can do it. We can do hard things. I just wanted to make that point for people who felt like they should have all these answers. No, this takes a lot of time. So unfortunately, we are out of time for today. But Dr. Russell, thank you so much for all of these questions and this guidance. And thank you to everyone who joined us and contributed your voice to our community. I did want to point out, Dr. Russell mentioned a few times Dr. Walt Karniski, and he is actually doing another webinar for Attitude. It's not until January. It's January 19th, but it is specifically on treatment options for ADHD. So it's not on the website yet, but we have booked the date. So please mark your calendars for that. If you are listening in replay or podcast mode, visit attitudemag.com and search podcast 421 to access the slides, the webinar replay, and the certificate of attendance option. If you support the work we're doing here at Attitude, we encourage you to visit attitudemag.com/subscribe and sign up for Attitude Magazine. And sign up at attitudemag.com/newsletters to get all the alerts about all the webinars. And thank you so much for joining us today for this event. We'll see you soon.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.